It's an unfortunate reality that impacts far too many families: suicide. WECT's Mackenzie Bruns attended a gathering today aimed at preventing suicide, and mental health experts say it all starts with a conversation.
I'm here outside the new Hanover County Government Center, where over 80 people have gathered today to learn more about the hidden impacts of suicide. Trillium Health Resources hosted a suicide and PTSD awareness symposium where people of all different backgrounds listened to guest speakers on how to come together as a community and support those struggling with their mental health. Victor Armstrong works for the American Foundation for Suicide Prevention. He says suicide is so prevalent, the conversation needs to be normalized, which would have a major impact on saving lives.
Self is not a disease. It is actually the worst possible outcome of a lot of very complex things, often including mental health challenges. But what that means is, if it's a combination of complex things, it means that if we have the right resources in the right place at the right time, in communities where people live, work, play, and worship, we can prevent suicides.
Armstrong tells me if you are struggling with suicidal thoughts, to call the 988 Suicide and Crisis Hotline. Mackenzie Bruns, WECT News.